Good evening to all. Today we discuss about the some question for DHA exam and NCLEX RN exam. First question is: the nurse is caring for the client scheduled to undergo a cardiac catheterization for the first time. The patient that are scheduled for the cardiac catheterization is going to first time. Which information should the nurse share with the client regarding this procedure? Actually, when any patient going for the first time for any procedure, then what is the basic information that provided by the nurse? You understood that what is the basic information that nurse provide for the cardiac catheterization to the patient? The procedure is performed in the operating room. The cardiac catheterization is not performed in the operating room. This is performed in the cardiac cath lab. Okay, this is the procedure that is performed in the cardiac cath lab. There is a special type of the room that is especially designed for this type of the procedure. Okay, cardiac catheterization room. That room is a darkened room, so that this procedure not performed in the operating room. So you not explain that this procedure is performed. So this is a wrong answer. Second option, the initial catheter insertion is quite painful. After that, there is little or no pain. This is totally wrong because patient may feel pain, and the patient also receive local anesthesia for this procedure. Okay, and local anesthesia is given before the starting procedure. You may feel fatigue and have various ache because it is necessary to lie quietly on a stationary X-ray table for about 4 hours. No, this procedure may take only 2 hours, maximum 2 hours. So there is no requirement to lie for the 4 hours. So this is a wrong answer. And you may feel certain sensation at various points during the procedure because actually patient administered with the dye before catheterization. So here there is a chance that patient feels some sensation. Fluttery feeling means feeling of that something moving in the artery or in the body of the person. This is a fluttery feeling. Flushed burn feeling. Flushed feeling means suddenly when the face is having redness, this is known as flushed feeling and warm feeling because the patient received dye. So patient may feel flushed or warm feeling. Desire to cough or palpitation may be seen due to the injection of dye in the patient. So this is a normal condition that you explain before starting the procedure to the patient. Actually, in the cardiac catheterization, you also explain that cardiac catheterization procedure in the cardiac catheter procedure. This is an invasive test in which we introduce the catheter in the patient heart. Before introducing the catheter, we administer the dye into the heart. Okay, so there is a best information we receive by this dye. Procedure, when you perform the procedure, you perform this procedure in the cardiac catheterization room. And when you perform this procedure, you attach the ECG lead to patient, and you require also some X-ray during the patient cardiac catheterization. But this procedure take up to 2 hours. So there is no need to lie down for the 4 hour for the X-ray stationary table. Okay, so this is a wrong option. But right answer is because patient have administration of the dye, so there may be a sensation of the various point during the procedure, like the fluttery feeling, flushed bum feeling, desire to cough, or palpitation. Okay, so this is the right answer. The next question is: a client has undergo angioplasty. What is the meaning of the angioplasty? Angioplasty, angiography, angioplasty. Plasty means repairing. Angio means vessels. Repairing of the vessels repairing is known as angioplasty. And another term is angiography. What is the angiography? Graphy means visualization and angio means blood vessels. So visualization of the blood vessels is known as the angiography, and angioplasty means repairing of the vessels. Okay. So here in the question, a client has undergo angioplasty of the iliac artery. Actually, we repair the iliac artery in this question. Which technique should the nurse perform to best detect bleeding from the angioplasty in the region of the iliac artery? Actually, in the iliac artery, if there is a bleeding after procedure happen, then how do you check that here is bleeding happening? Palpate the pedal pulse. Actually, pedal pulse is the informative for your check the patency of your vessel. That vessels is patent. There is no clot in the vessels. Means there is a proper supply of the blood to your means foot area or your distant area of the body. But this not indicate that there is a bleeding or no bleeding. This only indicate that patency of the blood vessels. That there is a blood that is patent and supply the proper blood to your distant area of the body. Actually, measure the abdominal growth. Yes, if the iliac artery where you angioplasty means when you repairing the iliac artery. So if there is a bleeding occur, then there is a accumulation of the blood in the your retroperitoneal cavity means in the your abdomen. So if a blood accumulation in the abdominal cavity, so there is a increase in the abdominal girth also present. So you check for the abdominal girth to check or to identify the bleeding. Yes, this may be done. Assess the client about the level of the pain in the area. Actually, pain not directly inform the nurse or any healthcare worker about the bleeding. Actually, pain may be perceived by the patient because there is a angioplasty means there is a procedure is performed. So there may be a little pain may be happening in the patient, but this not directly indicate that bleeding happening in this area. Okay, actually if the bleeding occur, then there is accumulation of the blood in the abdominal cavity. So the abdominal cavity size or abdominal girth may increase. So right answer is a B. Auscult over the iliac area with a Doppler device. Actually, Doppler device, when you auscult, then you also feel the pulsation, but this pulsation not indicate that there is a bleeding, because pulsation is a normal, because they indicate that there may be a blood supply occur, but not indicate the bleeding. So there is a right answer is measuring the abdominal growth to check bleeding after iliac artery angioplasty. Okay. And next question is acetyl salicylic acid is prescribed for the client diagnosed with the coronary artery disease before a percutaneous transluminal coronary angioplasty. The nurse administered the medication understanding that it is prescribed for what purpose. Actually, aspirin is an NSAID medication and aspirin is an antiplatelet medication. Okay. What is the function of antiplatelet medication? Antiplatelet medication prevent the meeting of the platelets, means there may be a if there is no clumping of the platelets, so there may be a no formation of the clot. So this problem, this condition prevent from the this condition especially prevent the clot formation. Okay, occlusion of the artery due to clumping of your platelets, because this is an antiplatelet medication. If examiner asks that if patient receiving the acetyl salicylic acid means aspirin, then what is the complication or side effect here occur? Then your answer is a bleeding, because patient antiplatelet means platelet are not clumping together, so there is no proper clotting formation, because actually after clumping of the platelets, then the clotting factor work on here. So if the platelets are not clumping with each other, then there is a bleeding chances occur. So if examiner asks that what is the side effect or complication of the acetyl salicylic acid or aspirin, then your right answer is a bleeding. Okay. Then next question is the nurse is performing an admission assessment on a client admitted with the diagnosis of the Raynaud disease. Actually, I explained previously that in the peripheral arterial disease, there are the two diseases we discussed. Peripheral arterial disease. In the peripheral arterial disease, we discuss about the two disease. Actually, one is a thromboangiitis obliterans, Bursar disease. Bursar disease is also known as a thromboangiitis, thromboangiitis obliterans, obliterans, and other is Raynaud disease. Actually, in the Bursar disease, there is a condition that arise by the smoking. If patient take smoking, then there is a what happen due to smoking, the small blood vessels constrict, so blood supply interrupt, and this cause your arterial occlusion occur. Okay, in the Raynaud disease, there is a problem is arise due to the cold application, or when the person is exposed to cool area, then there is a constriction of the blood vessels, or so there is a diminish the blood supply or pulse, and if the diminish the blood supply, then there is a condition is arise is known as a Raynaud disease. So the nurse assess for the associate symptom of the performing the which condition, check for the rashes, because in this condition, in the peripheral arterial disease, in the Raynaud disease, there is no any type of the rashes seen. So this is wrong answer. Observing for the softening of the nail or nail bed, actually this is not a nail bed problem, or here no softening occur. Palpating for the rapid, actually there is no rapid or irregular pulse. Actually there is a diminished of pulse because there is a occlusion occur. No proper blood supply, there is no increase in the blood supply, there is a occlusion of the blood supply, means there is a reduction in the blood supply, so there is a chances of diminish the or absent of the your pulses, peripheral pulses. Okay, so if examiner asks that Raynaud disease is precipitated by, then your right answer is a cold exposure. If examiner asks the other name for the Bursar disease, then what is the other name for the Bursar disease? Bursar disease is due to the thromboangiitis obliterans. Other name for this is thromboangiitis obliterans, and this disease is occurred due to the smoking. So you also advise the patient to quit or stop the smoking. Okay, so here is right answer of this question is palpating for the diminished or absent peripheral pulse, because there is a condition arise due to obstruction of the artery. Okay, so there is a diminished in the pulses. Okay, then next question is, a client is admitted to the hospital in the sickle cell crisis. For what clinical indicator should the nurse monitor the client? Actually, what is the sickle cell crisis? I also explained in the previous class, in the yesterday class. What is the sickle cell crisis? Actually, in the sickle cell crisis, there is a hemoglobin is S type of the hemoglobin present. When the person is suffering from the deficiency of oxygen in the blood, then your RBC is converted into the sickle cell. And if the RBC converted into the sickle cell, then what happen actually when the sickle cell RBC actually when the RBC converted into the sickle cell, then they are not easily travel in the your blood vessel. They are clumping with each other. If they clumping with each other, then they obstruct the blood vessels, and the sign symptom of the obstruction occur, means there is ischemia type of the condition occur, because due to the clumping or due to the obstruction of the blood supply, the next organ are ischemic in condition, so there is a ischemic sign symptom may occur. Okay, so in the sickle cell crisis, the patient feel the pain. Actually, if there is any type of the ischemia happen, then the patient is suffer from the pain. Okay, what happen actually, because there is a reduce in the blood supply. Okay, and examiner may ask the question that which condition precipitate these condition. If patient suffer from the any type of the infection, in the infection your metabolism rate is increased. If metabolism rate is increased, then the need of the oxygen is also increased. So when there is a need of the oxygen increase, then what happen actually, when in your body the need of oxygen or the in the blood oxygen level is reduced, then there is a changes in the shape of the RBC. Okay. So always remember, when in your body the oxygen level decrease, the shape of the RBC also increase due to sickling process. So if examiner that ask that what factor precipitate the sickle cell crisis, then your right answer is infection, stress may be occur, and fever. A patient is suffer from the fever, then there is also increase in the metabolism. If by any reason the increase in the metabolism, so what happen actually, if the by any reason, if there is increase in the, if increase in the metabolism, so need of the oxygen also increase. If need of oxygen is increased, then what happen, the RBC converted into the sickle shape, so this crisis occur. Okay, so I hope you understood these questions, and we discuss some next question in our next lecture. Okay, thank you so much, and I hope you enjoying this session, and I try my best. Okay, thank you.